Hello, Rachel, and welcome to the podcast. How are you?
I'm good. I'm so happy to be here with you.
I am, me too. I'm so excited that you're here. I was thinking about, for a while, I wanted to invite you to my podcast. So I was like, oh, Rachel, I get to see you again. So
I'm
for
honored.
everybody, I've planned to explain if everything goes well in the welcome about how you and I are friends from being in a mastermind group with the same coach for a while, and we had such great conversations. And I'm excited to bring you onto the podcast because of all the great reasons, but also it's a great opportunity to kind of demonstrate through getting to know you how public health overlaps in a lot of industries, and to see just public health in action in a slightly different setting and from a different perspective. So um, let's just start with you telling everyone a little bit about yourself.
Sure. Well, my name is Rachel Cahill. I use she, her pronouns. I live in Cleveland, Ohio. I've got three kids and a dog and a big life, and love the independence of consulting. I've been doing policy advocacy consulting for a little over 7 years, but I've been in the field of anti-hunger work for more like 17. So, fundamentally what I do is public policy advocacy and coaching. My specialty is the Supplemental Nutrition Assistance Program, which is SNAP, also known as food stamps. It's the main anti-hunger program we have in the United States. And so I have really specialized in that program and supporting advocacy efforts around the country to strengthen that program and make it more accessible and equitable wherever it exists.
Awesome. There's a lot packed into that introduction. And you do such amazing work. So I one of my favorite things on this podcast is to kind of follow the journey, like go back a little bit and follow the journey. How did you get from there to here? So I'm going to ask you what I often ask my guests, and this is where also one of my favorite questions. But when did you first learn about public health?
Yeah, so I dove into the anti-hunger and anti-poverty space, really from before I went to college and during college and right out of college. My first job was at an anti-hunger organization. And one of my first sets of colleagues and coalition partners, I will say, were at the Drexel School of Public Health. So my second job after working at the Anti-Hunger Coalition was actually at the School of Public Health in Philadelphia. I don't have a public health degree. I have a public administration master's. But from an early point in my career, I understood kind of what public health was, public health's unique approach to solving problems. And I learned a lot from being in that space. Sometimes I butt up against public health and said, I'm for action, less study, more action. So, but it's kind of been integral to my journey as an advocate.
Yeah. Yeah. That reminds me, we have a friend in common. And I
Yes, we
keep
do.
she was on our podcast way back in, I don't remember what episode, it was way before 100.
Lovely.
And
Leah
Leah
Roman is who I
Roman.
think
Yeah,
you're talking about. Yes, we work
yes.
together at Drexel School of Public Health.
That is wonderful. She does. I actually will be bringing her back on the podcast. I'm doing a series of bringing back some of the older guests from the earlier phase to see what they're doing now. So um, hopefully we get her on here pretty soon. But that's really interesting. So public health administration and your understanding of public health, and it's easy for people to try to separate them out, but I don't really see how we separate them out. There's such an overlap. Um, is there I think I know the answer to this one, but a particular population or public health issue or problem that you are most passionate about?
Yeah, absolutely. So I work as an anti-hunger advocate. Like I said, food is health. Food is the basic of basic needs. You cannot learn, you can't be healthy, you can't, live up to your human potential without basic nutrition. So, food is my jam. I really come to it from a poverty perspective, though, right? Some people come to food advocacy because they're foodies and they just love food.
Right.
Maybe they like to grow food, maybe they're farmers. So there's all sorts of cool intersections with the anti-hunger movement. But I really come to it from just an anti-poverty perspective, like any means of resourcing families with dollars to make better decisions or healthy decisions for their families, I am for. So one of the reasons that I'm so passionate about the SNAP program within all of the many anti-hunger programs is because it gives people autonomy, right? Like SNAP, if you don't know what it is, it's like nowadays it's a debit card. It's like a credit card that only works for food, and it's needs based. So it's based on your income level, but people use it through normal modes of retail. So, it's meant to be able to be used at grocery stores, at farmers markets, everywhere that everyone buys food, as opposed to, an emergency food program, which is maybe a bag of food that someone else has picked for you, or the WIC program, which is a wonderful program, but it's very limited in the types of food you can get with WIC. So I really like SNAP because it gives people autonomy and dignity to make the choices that are best for them and for their family. So that is, and continues to be my passion point in public health, and sometimes a point where I'll butt up against, folks that are very, come to it from a dietitian perspective, or a nutrients as specific ingredients kind of a perspective. And so I'll try to widen that lens and say, yes, nutrition is important, but so is autonomy to people's health. And so, let's keep that broader perspective in mind when we're making policy decisions related to SNAP.
I get it. I get it. So is this something that you've always been interested in? I'm not knocking over my mic. Is this something you've always been interested in? Like, does this go back to when you were younger, or is it just something you just stumbled into at some point? Like, when did you, because I can feel and sense your passion and your care genuinely about this topic for people. So is this something you've always carried with you, or yeah, tell me a little bit about that.
It's a question I've thought about. I actually initially thought, so my undergraduate degree was like in global population type of work. So I thought I was going to work in international development or something. And so I studied in India, and I spent a lot of time in kind of understanding poverty outside of the United States. And, I had a couple of formative experiences in college and right out of college where I kind of realized that I needed to start at home if I really wanted to make a difference, right? This was the culture that I understood. I also grew up with a lot of family members who benefited from and needed the support of public assistance programs. And so I moved to Philadelphia and said, let me work on poverty here before I try to solve and be some sort of white savior somewhere else. So I think that I had to go through that evolution to realize that was the place to start, was at home. But
Yeah.
ever since then, I think I've stuck with SNAP. The other thing is I kind of thought it was going to be non-controversial to work on hunger, politically uncontroversial. Everybody likes food banks. No one wants children to go hungry. I thought it would be kind of safe. And the longer I've been in the space, I realized that the program has, it's gotten somewhat politicized. It's gotten used by both sides of the political aisle in ways that are unfortunate. But I'm not afraid of that fight anymore. Now I'm willing to say yeah, sometimes hunger is a policy choice, and it's our job to call that out and push back on that. So I think just the longer I've been in the movement and people I've learned from who, like the welfare rights movement that came in the 1960s and 70s before me, the more I study the history of this space, I think the more invested I have become in it.
I see. Yeah. So tell us a little bit. Let's pivot a little bit and talk about the kind of work that you do. Um, Describe your ideal client to us.
So I have two answers to this. There's the people that I directly support, and then there's the organization and funders who enable that support, is kind of how I see it. So, my ideal client is a SNAP advocate. That's sort of a self-described advocate who wants to see the SNAP program work better in their local community. And they might be an employee at a food bank or at a policy organization or another anti-hunger organization. Sometimes they might even be a staff member for a legislative office, but they are passionate about making SNAP work better, and they need sort of the policy and training background. They need some of the advocacy skills and tools to be able to be effective change makers in their local community. So I work with those folks directly to help them kind of take on big projects. Like, we want to pass some big policy change in our legislature, but I don't even know where to start. Or we got this really terrible bill filed in our legislature, and I don't know how to fight back against it. Like, I don't know what arguments to make. I don't know what the economics of it are. So I will help them with their direct advocacy work. But the ideal client is usually a larger organization who funds that position, right? It's either a national organization who does grant making, a statewide organization that is trying to support a lot of food bank associations, for example, then support food banks and advocates within that state. So I will work usually with those larger anti-hunger organizations to make sure that we build capacity for the growth of those folks who are on the ground.
Okay. So now I'm curious. So let's say you mentioned some of the controversy, and you mentioned sometimes there's this theoretical or research approach versus the practical applied. So tell me a little bit about where the tension, like maybe an example, or where the tension lies and where you bump heads maybe, and maybe you have like these different perspectives can cause an issue.
Yeah, absolutely. So because I live in Ohio and I grew up in Nebraska, for whatever reason, I have tended to gravitate to supporting advocates that are operating in more conservative states. So states that may be more politically challenging to push for broader expansion of a program like SNAP and other public assistance programs, because there is some delicacy to how you build alliances and how you talk about the program. And one of the first pieces of advice that I give folks who are working in a challenging environment politically when it comes to support for these programs is to say, think about sort of unusual partners. So think about your grocers. Do they have a grocer retail association? Think about your farmers. Think about their association. So groups that you might not naturally already know or have alliances with, but who care about food and care about people's access to food and care about the economy of food, look for partners there. They might not be coming to it for the same reason as you, but you might have a shared interest in the outcome. So that's often a way that folks can start to build relationships. The other way I approach it is that most of the people who actually run the SNAP program are not political appointees. They are government employees, right? They might work at a Department of Public Health or they might work at a Department of Social Services. And all they're trying to do is run an efficient, effective program and be a good steward of taxpayer dollars. So if you can get to know those folks and work with them on, small changes that make the program run better, then you sort of take the politics out of it and say, this isn't some theoretical fight over public assistance or not, or pulling yourself up by your bootstraps or not. It's really just about running an effective program and who are your allies in doing that.
Is there a danger of this program being removed or pulled out from certain states?
So the bigger risk is it's like death by 1,000 paper cuts, right? One of the things that we see happen, and this happens to public health, in all ways. But when we see there might not be an intentional decision to cut back on the program itself, maybe there's no explicit goal that says we want to drop participation by 20% by this time next year. But if you starve an agency of resources, you start to see call wait times go up, and you start to see application backlogs, and you start to see documents getting lost, right? And the next thing you know, like in the state of Tennessee right now, we've had about a 40% drop in participation over the last year. So compared to many other similarly functioning economies that have seen a slight growth in participation, because hunger is actually going up right now. But in Tennessee, we're seeing this massive cut of folks. And it's not because there was a choice that was made to say, let's cut the program. It was that the agency it's not been funded, its computer system is breaking, and it's having a really hard time just existing. So that's where advocates on the ground are so necessary, to talk to the media, to talk to legislators, to recommend solutions to kind of get the program back under control.
Wow. Okay, well, I'm learning a lot today.
Don't you get me started, Charlotte.
Yeah, I know, but it's important work, and it's really great to hear. Thank you for explaining that and giving us the example. Really kind of brings it to life. Let's see about. I'm going to look at my notes because we can probably keep going, and I'll keep asking more questions. We'll get further down a rabbit trail. But let's talk a little bit. You described your ideal client, and you've talked a lot about how you can help each one. But are specific products or services that you offer, or is it just kind of depending on what's going on? But tell us a
Yeah,
little bit
this
more
is
about that.
something I've learned in being in mastermind with people like you who are entrepreneurs and think about, providing services that are meaningful in different ways. So, one of the offers that we just started this year is like an individual coaching offer. It's like a 6-month program for emerging advocates that are, essentially it's professional development for someone who their organization wants to invest in them, but they don't have a supervisor on site who has the knowledge or expertise to coach them. So that's where we're a resource for folks. So that's a new offer that an individual organization can sign up for rather than sort of a bigger organization who's offering it to all their grantees. There are other kind of products that will offer like a SNAP policy landscape, a report to say, for your state, do you even know what changes you might want to make? If you don't know what choices your state has already made, it's really hard to be an advocate and come up with an advocacy plan. So most states need like a foundational understanding of how their program even works before they can even set goals or get their board of directors to sign off on a strategy. So we'll do that. And then the other thing we do a lot of is like data analysis and presentation, which I know you also do a lot of. I mentioned call centers before. There's a lot of metrics out there that advocates don't necessarily readily have access to track and monitor over time. How many calls, what percentage of calls are even getting answered? In my local county, in Cuyahoga County, we've been tracking this data and it got down all the way to only 30% of calls were getting answered. It was almost as if this program had become like a lottery system because it was so hard to get through, and cases, eligible people were getting denied because they couldn't get through on the phone. So we will pull together some of that data and present it so that those organizations can make a case for funding. They can make a case to the legislature to make a policy change, to resource the agency, all of those things that are part of advocacy. We can take that off the plate of our clients and help them get it done.
It's exciting. I know that I just have a feeling that that people in my audience are listening and finding this very helpful because I think that it's needed. Those resources are important, and I like that you're really filling the gap with what you're offering and how you're helping. So I'm excited about that. Um, I also like to try to connect the dots a bit, and again, having, with public health administration, we could easily kind of say, oh, these are so separate, but they are not. So let's do a little connecting the dots because I would love for you to elaborate on how the understanding of public health helps you serve your community, your clients, and have a bigger impact.
Yeah, I think one of the most critical arguments that we have in defense of programs like SNAP is understanding how it affects kind of community health or our overall environment and how we spend money on healthcare, for example. So there's a study I was a part of several years ago that helped demonstrate that it was like a dosing study, for every additional $10 in SNAP, we were able to see hospitalization and nursing home admittance go down for older adults who are enrolled in Medicare and Medicaid. So, a very expensive population. There's a lot of resources that go into supporting that group and coming up with both public health and medicine solutions for them. And just providing some extra food dollars, right, had this huge impact on what we're spending on in other departments. But it often doesn't get seen, right? Because they're not the same agencies who are footing those bills. It's more of a collective understanding of our community's well-being, our community's health. So it comes up in so many spaces. If you want to talk about walkable communities, it comes up. If you talk about, grocery deserts or food deserts, as they're talked about, which is a big public health issue, right? SNAP comes up. Who's going to pay for that? Who's going to be the source of income for that new grocery store that you want to bring to the neighborhood to make it more walkable or to improve the nutritional well-being of folks there? Like, SNAP needs to exist. So I think that there are so many intersections. And one of the places that I think I try to encourage my public health friends to think about being advocates for SNAP, like full stop, as opposed to being advocates for ways we can change SNAP to make it more focused on nutrition exclusively. That's the place, like I said, where I sometimes I find myself like making up definitions for public health to try to get folks to like see my way of thinking, because I do think that that's SNAP is an intervention because it puts dollars in people's hands to buy food, and not because it's an intervention that can tell people how to eat. That is, I guess that's my approach to the scene. Um, and and I think that's a conversation we need to keep having so that folks who believe in public health and want to invest in it kind of stay aligned when political tensions come up. The Farm Bill is an example of this place where this tension comes up every 5 years. It's a big piece of legislation. A lot of public health folks in the last couple of cycles have gotten involved in it, which is awesome. And we need to be kind of speaking the same language and sharing information so that we're like moving in the same direction instead of working against each other.
So if I'm hearing what I'm hearing, tell me if I'm off or not. So there is a move to more restrict what people can purchase with SNAP as a way to sort of influence, I'm going to use that word instead of another word, but influence their choices to kind of move them toward better nutritional options and foods, right?
Yeah, that's right. That has been a kind of an underlying current, I'd say, for the last 10 years of, how pushing SNAP to change to be a more restrictive program, which would just fundamentally change what it is and what it does in our economy.
Right. I definitely understand that. Um, that's very interesting too, because as I hear you, and you and I've had these conversations, but as I listen to you, and we've had more elaborate conversations on this, but really thinking about, like you're saying, that taking away that autonomy, I think that how successful have we ever been just trying to tell adults what they have to do, as opposed to giving them the options and giving them the really clear facts, and then helping them to understand how to make better choices based on factual information.
Yeah, and there's some really great science to back this up. This isn't just kind of like my advocacy pitch. There have been a lot of demonstrations that have showed that incentives, work better than restrictions. So even in the SNAP space, there's several really successful. It's called the GusSNP program now, but it's basically like a dollar for dollar. Spend on vegetables and get more money for vegetables. Kind of a design. That kind of an incentive works great. Let's do
Yeah,
more of that, right? As opposed to
right.
restricting and shaming and telling folks, you can't buy this, you can't buy that. It just doesn't work.
Exactly. Exactly. I could go on a tangent, but maybe I shouldn't. I just will say that anything that's going to introduce shame is not. How are we going to win? How is that? How is that really helping improve health? If you get people to eat things that are more nutritious, but then what are they suffering on the other side if they're exposed to more shame and more stress and
That's right.
yeah,
And I think it's important to know, I should have said this at the beginning, like the thing we're trying to solve for from a public health perspective is food insecurity. And food insecurity itself is not knowing where your next meal is going to come from, or not reliably having consistent access to healthy and nutritious food for an active and healthy life. Right. And so
right,
you introduce that stress, you introduce that shame. Now, and just about everybody who accesses SNAP, qualifies as food insecure. So when you put those two layers together, we always know that health is going to be negatively impacted when you add stress and shame onto a program. And so SNAP already unfortunately has a lot of that in the eligibility and enrollment process. And so we don't want to add to it at the grocery store when you get to the checkout line and you get told, no, you have to put that back. Now you're holding up the line and you're embarrassed. And, it pushes people away from the program. So anything that we can do to equalize access to SNAP and to make it feel safe for people to use is what we advocate for.
I love it. Thank you so much for sharing that with us. Just a couple more questions, and then I'll be able to let you go. This has been insightful for me. I know my audience is enjoying as well. Um, we have a very broad audience of listeners, from students to all types of professionals and consultants, entrepreneurs in public health. But do you have any advice for anyone listening in public health who may be also interested in, similar work?
Yeah, I love recruiting new SNAP advocates, whether they are going to work in a traditional nonprofit or whether they're in a public health office or whether they're in industry. I think all of us can be SNAP advocates. So that's why I say a self described SNAP advocate. I honestly think the best thing to do if you want to better understand how SNAP works in your community is lean into the lived experience that people in your community have about what it's like to use SNAP there, right? It might be you. You might have that personal experience. It could be a family member. It could be that you just go down to your local SNAP office. Some places it's called a welfare office or an assistance office or something like that. Go and see what it looks like, like pick up a paper application and try to fill it out. You don't have to turn it in, but see if you could, I think it sensitizes you to how, to that, is there shame? Is it accessible? Is there barriers for people with disabilities? Try, if you speak a second language, try to ask to apply to SNAP, in another language and see if you get served. So there's a lot of ways to kind of like stress test your local SNAP access point, and I bet you'll come up with 5 ideas for how to make it better. And now you're a SNAP advocate. The organizations that care about that, every community has a food bank. Every community has emergency food providers, and more those groups are very invested in SNAP too, and improving SNAP access because it's all part of the ecosystem of food. So take that checklist of things I found in my local office, right, and bring it to an organization who cares, and now you have your foot in the door.
What a great idea.
That's
I
how I
love
got,
that.
I mean, that's how I got started. I just went into the local offices in Philadelphia and tried to understand how to apply, and was just like mind blown at how many opportunities there were for improvement.
Yeah, really. I love that. I'm going to share in the show notes links to how to connect with you. But just for someone who's listening now and curious, what's the best way to find out to connect with you?
Yeah, I am on LinkedIn. That is my main place where I kind of share commentary and my perspective on the world. We just recently started a blog also for the RCC team. So that's at RC Consulting, R Cahill Consulting. They'll both send you there, and you can see our blog. But most of our material is on LinkedIn, and that's how I would love to connect with folks who hear me on this podcast.
Wonderful. Well, everyone knows if they're regular listeners of the podcast that I'm a big LinkedIn advocate. So I'm glad you said LinkedIn. And we'll have links to all of that in the show notes. Rachel, thank you so much for taking time to put this episode together with me. I really enjoy hearing you and learn something every single time.
Well, thank you for being, an inspiration and an advocate in your own spaces. I've referred many public health students and professionals to your podcast and to you to learn from you as a model of how to do this work in different ways. So thank you for always being an inspiration for me too.